President.
Speak up just a little bit for us.
It's really low. Thank you, Mr. President. In this laboratory is where we generate the materials that go into all of our diagnostic tests, not just for the coronavirus, which you have the electron micrograph here, but also for all the other infectious agents that we work with. And the advantage of having this facility here is CDC is constantly listening for infectious disease threats, both within the U.S. and around the world. And when we first heard about this unusual illness in Wuhan,
All right, welcome back. And we have some breaking news right now. Live pictures from the CDC. Of course, that is President Trump, and he is there with Alex Azar, and they are listening to some instruction from someone at the CDC, which, of course, is at the forefront of fighting the coronavirus. You see Senator Kelly Loeffler there. Governor Kemp is there as well as is Senator Perdue. And it looks like they're going to walk a little bit closer to the camera. So
I believe President Trump is about to start speaking.
Yeah.
We're going to listen in and listen to his comments.
So CDC is always listening for infectious disease threats, both in the U.S. and around the world. And we heard early on, at the end of December, about this unusual illness that was taking place in Wuhan, China. And the fact that it was associated with the seafood market led some evidence that it might be this, what we call zoonotic transmission from animals to people. As soon as the Chinese announced that it was a novel coronavirus, and the Chinese, to their credit, made that sequence information available right away, our coronavirus experts here at CDC used that sequence information to design a test so that we would be able to detect the virus. Even though at that time there were no cases in the US and we had no samples of the virus because we had no clinical materials. And so we quickly went from designing the test, and the materials were made in these laboratories, the quality control is done here, and then our scientists used that to validate that it would work against what they could make as the coronavirus using just the sequence information, but importantly so that it would not detect other things, because you want a positive to only be for the coronavirus, not for other kinds of viruses that create similar respiratory samples.
Does everybody understand that?
Can we ask the question, please?
Yeah, sure. Just one second. Let him finish up.
And then in relatively short order, as the information coming out of China indicated that this was more serious than was originally thought, originally 7 cases, we stood up our incident management system here at CDC so that we would have all the right components together, the epidemiology, the laboratory, the communications, the policy folks. And then once it became clear that it was even more serious, that's when we started to work with our colleagues at FDA to say we need to make this test available to the larger public health laboratory community, and so worked with FDA
to tell them about how have you done with the test.
To get what we call emergency use authorization, so that we could distribute the test originally to our public health laboratory counterparts. And now working with the commercial manufacturers, we're in position to scale up that production beyond what we can do with our own facility here, so that there's the capacity to test more and more Americans. And we are, as we work today, to qualify more of those materials to go out. And it's important to note that at no time during this response has CDC ever denied a request that came from a public health official, either state or local, to test a patient. So all the patients who needed to be tested, in the opinion of the public health officials, have been tested.
They have plenty of material, is what you said.
And yeah, all of our state labs now have the ability to test for this virus.
And they have had. Doctor, do you want to make a little statement?
What's your name again, sir?
Dr. Steve Monroe.
Well, I think first I want to thank you for your decisive leadership in helping us, put public health first. I also want to thank you for coming here today and sort of encouraging and bringing energy to the men and women that you see that work every day to try to keep America safe. So I think that's the most important thing I want to say.
Thank you. I appreciate it. And the whole situation is, the testing has been amazing, actually, what they've been able to produce in such a short period of time. You had mentioned 4 million tests before? 4 million.
By the end of the week, hopefully.
Next week.
And the following week will be at
What number will it be?
Up to 4 million tests available in the United States by the end of next week. We've got commercial labs are getting validated as we speak. By the end of this weekend, we'll, as promised, have enough testing for that CDC has produced for just test 75,000 people's already out, and then enough tests for another 1 million tests to be done. And that's most of that is shipped. The last lots are here being validated by Dr. Monroe's team as we speak.
The one thing I would like to add, the purpose of all of this, as Dr. Monroe said, is to have the capacity to detect the unknown. This lab's developed tests for Zika, SARS, MERS, and now this coronavirus. And I think it really is remarkable that the capacity we had here. Once we got the sequence, I think this lab team had a functional test in about 7 days that they then worked with the FDA to make sure it was regulated. I think that's really what we do.
And they started working when they saw there was a problem in China. That was many weeks ago. So they saw there was something going on in China long before anybody even heard of it. That was actually before it was even in the print. They heard there was a problem in China. That's when they started working on this, and that's pretty incredible. That's why we're in good shape.
Sir, is the coronavirus contained in the United States?
Go ahead.
Yeah, I think at this point, again, and we've said this before, and the Secretary can add, the overall risk to the American public does remain low. And again, I think we owe a lot to the decisive decisions initially to have travel restrictions and the number of areas of screening in airports. And then the most important is to get the public health community to do early case recognition, isolation, and contact tracing, which, again, the fact that we now had a test allowed us to do that a lot more effectively if we didn't have a test. We do have some areas where there's significant community transmission now. Obviously, we've seen that in the Seattle area. We've seen it in parts of California. We're working hard with the local and state health departments in those groups to continue to try to control this infection in that area. I think, as the President said, or maybe the Secretary, we still have only around 200 cases that we've diagnosed in the United States. We're going to see more cases because we're getting more diagnostics out there. But I would say that, again, what I said before, that at the present time, the general risk to the American public remains low. We're going to concentrate and help those communities, though, that are now fighting the battle. Like in the state of Washington, some of you were there, I think, the other day when we were out there. So,
I have a question for Dr. Monroe, please. Would you admit that the CDC did have problems with the testing? You say that there were people that the health officials never had to request anyone to test, but you set such strict guidelines, so people were coming in and saying they couldn't get the test. We've talked to dozens of people that have contacted us saying they couldn't get the test even though they had the symptoms because they didn't meet your criteria because your tests were faulty.
So we did learn shortly after we distributed the first batch of our tests to some of the state health labs that there was an issue with one component of the test. And so we quickly put together a team to try to figure out what that issue was, and we suggested that people not test until we could sort that out. But what we have are 3 different signatures that we test for, and in working with FDA colleagues, we identified that 2 of those were sufficient to have a positive conclusive test. And so we've moved forward now with testing with just the 2 signatures. And this is something that could easily happen where we're just, again, starting from scratch with sequence information, building a test rather rapidly. We did small-scale testing here before rolling it out because our goal was to get it out to the public health labs as quickly as possible.
But you didn't have to start from scratch. You could have just used the WHO's test. Why did you choose to start from scratch when it would be a longer process?
But we started with our test probably at the same time the Germans and the other Italians.
We are watching live coverage of President Donald Trump. He is in the headquarters of Atlanta-based CDC. It is putting the national agency back in the spotlight. President Trump speaking very little. He's allowing the experts to answer questions that the media clearly wants answers to about the coronavirus. This comes on the eve of an $8.3 billion package of emergency aid for coronavirus response by the Trump administration. Americans have been warned to not travel to Italy or South Korea because of the outbreaks of this disease. And we have 3 cases just within the last week here in Atlanta.
And you heard one of the reporters there ask the president, is the coronavirus contained? and the president didn't answer. He referred the question to some of the experts that are with him, but clearly he didn't want to have to say that, no, in fact, the coronavirus is not contained. He didn't want to be seen publicly saying those words.
And also, the president mentioned about the testing kits. We've heard about that. The testing kits in Georgia, Governor here, Brian Kemp, announced that the testing kits have been released in the metro Atlanta area, also for the state of Georgia, one day early, the day before President Trump arrived at the CDC. But now the CDC is pumping out even more of those tests. And by next week, he had mentioned that there would be millions available for the entire country within the next week.
And as more people are tested, we're going to learn about more cases. And so the numbers that we're seeing now with 1, 2, 3, as these tests become more readily available, we do expect, and the scientists expect, that those numbers will go up. So we'll continue to follow the president's trip to the metro area.